Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you. I have with me here today Professor Garima Kachhawa, a professor of Gynecology and Obstetrics at the All India Institute of Medical Sciences, New Delhi. Thank you, Garimaji, for joining us, taking out this time for this conversation. I know how busy you are. Till half an hour ago, you were in the OT, and now you are with us, joining this conversation. Thank you so much.
Namaskar, sir. Namaskar.
This conversation is about the PCOS, or the Polycystic Ovarian Syndrome. And when I was a medical student, and probably it was true also when you were a medical student, we studied it as Stein-Leventhal syndrome, which was considered a rare disease.
Yes.
But today it seems it is acquiring the proportions of an epidemic. In your experience, do you think it really has grown in prevalence that much? Or am I just crying wolf when the wolf doesn't exist?
No, sir, I totally agree with you. And you're very right that even when I was doing my post-graduation, it was not that common. And it was not common to see such patients in general OPD. But now PCOS has taken a significant, it is a significant public health problem. And over the years, the cases of PCOS has increased. Previously, the PCOS patients we would encounter only in our infertility setups, in our infertility clinics. But now we can see it in our general OPD practice also, and around 10% of the patients are young patients coming with PCOS. At around 10 to 13% of the patients, they are PCOS.
Yeah. What are the usual symptoms with these patients come to you?
PCOS, as the name suggests, that it is a symptom complex. So it is a syndrome. Not one symptom defines PCOS. There is a group of symptoms, and they vary from person to person also. They vary from age group also. So symptoms most commonly that the patients they come to us are young adolescent girls. And these young adolescent girls, they present with some irregularity in their menses. Most common is delayed menses. Usually we all know that the menses, they come every month. And whenever these patients, they are having PCOS, the first and the most common symptom is delayed menses. And then they may be absent periods for 3 months and sometimes 6 months also. Then another symptom is increased hair growth. Now, since these patients are young college-going students, then this symptom of increased hair growth, especially on face, annoys them the most. And they say, we don't bother about menses, madam, but please, we cannot have hair on our face. So please take care of this problem. So these are the two most common complaints or symptoms in young patients. Otherwise, the women may also present with increased menstrual bleeding or delayed menses followed by increased bleeding. And then the most common symptom that the women, they to come to us is subfertility or infertility.
So, and while menstrual irregularities and facial hair are something which the patient can see, what the patient cannot see is what is happening in the ovaries. And the syndrome is called Polycystic Ovarian Syndrome. But then I believe it's not essential that every patient should have a cyst or cysts in the ovary, isn't it?
The name is polycystic ovarian disease. So it is, the name suggests that when we see on ultrasound, there are small cysts in the ovary. They are not newly formed cysts. They are basically unruptured follicles. Every month, ovary develops one follicle, and that over ruptures, and the ovum is released for conception. But in this disease, there is the follicle fails to rupture, and so it is arrested in their developmental phase. And these are various cysts that are trapped in the ovary, in the epithelium of the ovary, or basically they are unruptured follicles. They are not newly formed cysts.
It was basically an ovum that was expected to go to the full stage of ovulation, but could not. So the ovulation doesn't occur. And maybe to compensate for it, there are additional follicles which try to develop.
Yeah.
And that's how the number of these unruptured follicles, which may present as cysts, that grows in number.
And typical feature on ultrasound, the pearl necklace is.
Since it's a complex of symptoms, this syndrome, maybe you also get patients referred to you by other specialists rather than the patient directly coming to you. For example, endocrinologists or dermatologists.
Yes. Sometimes the patients, as I told you, most these patients are young women, young reproductive age women, and the most annoying feature for them personally is increased hair growth. So they will not come to a gynecologist because delayed menses, they don't bother because they are not married, they don't want to conceive immediately. So they think that let's go to the dermatologist, and even they go directly to the beauty parlors. So they refer the patient that, listen, there is some endocrine problem, there is some hormonal problem, you have to go and visit your doctor. So some of them, they come directly to us, referred by an endocrinologist, referred by dermatologist, referred by beauty parlor people. And sometimes these patients, they have, obesity. So they go for their obesity treatment. And so they are referred to us by obesity surgeons also.
So it means probably those who run beauty parlors also need to be more conscious of this
Yes,
possibility.
yes, yes. So they are aware, and it is also important that before going for any surface treatment or epilation treatment for hair growth, we should address the core problem of ovarian malfunction.
Sure, I mean, it makes sense to go to the root cause rather than treat only the superficial symptom.
Yes.
Do you also find many patients who remain blissfully unaware of the disease till they got married and then they failed to conceive for a few years, and it's only then that you discover that they had this issue?
Since
Yes,
PCOS also runs in the families, so sometimes the mother also has already suffered from some milder disorder of PCOS. So if the patient sometimes says that I'm not having my menses every month, so the mother will say, okay, don't worry, at least you are coming every 2 months. So the patients, they don't bother. Then they are young patients. They are not bothered about their menses or what exactly. They think that nothing can happen to us, otherwise we are normal. It is only once that they get married and there is some subfertility, they are not able to conceive, then they come to us and then they tell us that first regularize my menses, because my mother-in-law says that I will become pregnant once the menses is regularized. So a subgroup of patients, if the disease is not severe, if the hair growth is not that much, then these patients, they come with infertility for the first time to the doctor.
the PCOS is now considered to be a member of a group of diseases which are because of an unhealthy lifestyle. Now,
Yeah.
all the factors in the lifestyle, such as diet, exercise, sleep, uh, smoking and drinking, mental stress, which of these do you think is predominantly related to PCOS?
Yes, sir. Actually, it is the history of PCOS is told that women tend to store fat and carbohydrate in their body so that it can be used at the time of pregnancy and delivery. And in good olden days, there was a lot of hardships for these women. Now, with civilization and modernization, the physical activity level of women has decreased. However, the food habits have worsened in terms of packaged food, ready-made food, junk food. So a lot of carbohydrate is available for consumption while the physical activity is zero. So what we feel is that sedentary lifestyle is one of the most common basic platform for the development of symptom complex of PCOS. Added to it is the excessive stress. They have a lot of mental stress because of the education system, because of competitive exams, then the work culture also. So it is the sedentary lifestyle, a lot of stress, and also peer pressure, uh, some some element of depression or negative image because there is some hair growth. So a vicious cycle ensues: some hair growth, some depression, peer pressure, excessive eating habits, more loneliness, they don't go playing, and this all triggers the symptom complex of PCOS.
How about sleeping late and not sleeping enough?
Yeah,
Uh,
this is part, I totally agree. This is also part and parcel of the whole stress generating system, because if your sleep pattern is disturbed, then the baseline stress level also increases. And as we all say, that the healing of the body occurs during sleep. So a good sleep is very important, which if you are not following a proper sleep patterns because of the stress of your daily routine, then it will definitely aggravate the symptoms and affect the health. And I think these patients also are known to be resistant to treatment. So apart from medical treatment, lifestyle management is the basis for the core of PCOS. PCOS, as we have already discussed, is associated with weight gain, is associated with excessive male pattern hair on the face, and infertility. Now, these three things are very important key issues in the personality, negative personality development of a woman. So, women in young girls, especially college going girls, the weight gain, then hair growth, it all leads to negative body image. These women then have a vicious cycle, and they tend to avoid people, they are not going out with their friends, and infertility itself is a big stress for any reproductive age women, because they have a lot of community, social and family pressures on them. So the most important thing to deal with them is that we have to first assure them that this can be taken care of, and we have to deal one by one all the symptoms. And my motto is that whenever I treat a patient of PCOS, most important aspect is teach the patient about the disease. Once the patient is aware what is going wrong and how it can be controlled, then most of these symptoms can be taken care of, and we can pull the patient out from the corner in the society.
so patient education is very important. The patient
Very
should
important.
understand the
Yes.
disease.
It is the basic of the treatment of PCOS.
In any disease, prevention is always better and easier than cure. In this disease, what would your advice be to the girls and their parents so that the problem can be prevented?
As we all know that the basic, of course, the genetics, the environmental, they are important. But one of the most important modifiable factor associated with this disease is sedentary lifestyle, then the diet and weight gain. So all these things, they can be controlled. Most importantly is by lifestyle modifications. And what we mean by lifestyle modification is that for prevention, you should have an active lifestyle. It may be in terms of regular walks, it may be in terms of yoga, which prevents your weight increase and also keeps your stress under bay. You can have meditations regularly so that your stress level is decreased. So very important is that you should have a discipline, some discipline in your life. 1 hour for yourself. Let it be in terms of yoga, let it be in terms of meditation or regular walk, and to change certain things, like you can walk to the workplace, you can walk to the college if it's little nearby, or use a public transport, so that at least you're walking from your home to the public transport. So these are the small things, if you adapt in your lives, then you can prevent PCOS to a certain extent, or at least decrease its severity, so that even if the disease is there, it is not that severe. And the main basis is that you are able to ovulate every month. And if this much of physical activity helps you, prevention of junk food and a disciplinary diet, more commonly use the local produce or a freshly formed food. In that way, whatever you are cooking at home is very healthy. So you don't have to remove fat, you don't have to remove carbohydrate. Just eat small portions and eat fresh food. This is going to help and prevent all the complications of PCOS.
When a person who knows something about both yoga and nutrition, I would fully agree with you that a sensible diet doesn't have to be an exotic diet. It's a common sense diet, it's moderate diet, it's the type of diet that our ancestors have eaten for thousands of years, to which we have got accustomed. If we eat that diet in moderation, in quantity, without going in for the fads which keep coming and going, that is good enough. And when it comes to physical activity, I find that these days when youngsters decide to go for some physical activity, gym seems to be one of the fashionable things to go to. And when it comes to the comparison between gym and the yogic postures, of course, I'll not go into the fact that yoga is much more than these postures. But even if we restrict to the postures, uh, yoga is what something that gives flexibility to the body, and even the physical practices have a calming effect. At the end of the session, the person is relaxed rather than exhausted.
I
In the
totally
gym, it's just the opposite. The person is really exhausted, and the movements are jerky and quick. And therefore, the chances of injury are much more. And therefore, even if the person wants to go to the gym, I always suggest to them that do both, because yoga will give you the flexibility which will help you go to the gym and do those practices without getting injured.
And also, it is very important that gym usually have muscle building exercises.
Hmm.
And here you need to keep your body moving in one form or the other. So walk, yoga is the best. And if you want to go, it is one of the drawbacks of gym is that you cannot adopt it as a part of your life. It will be limited time period. You'll go for 6 months, then you'll not go for another 1 year, then you'll go for 3 months. So that is a drawback of gym also.
And that also, they keep starting and dropping off. What I say
Yeah.
is that yogic postures, once you have learned from a teacher for a few days, then you
Yeah.
can practice on your own. It is
Adopt.
something for which you don't need a companion. You don't need to change your dress. You can do it at home. The weather doesn't stop you. You don't spend time on commuting. So that's one of the simplest things you can do if you build it into your daily routine. And
Yes.
if you're not going for a regular class, the regular class may be 1 hour. If you are at home, you can be more flexible. Someday you may spend only 10 minutes on the posture. Someday you can spend 1 hour. I mean,
Yes.
and anything in between. So you have flexibility in terms of how much time you spend. And if you're doing it early in the morning, you can do it in a night dress. The only requirement, the dress should be comfortable and it should not restrict the movements. That's the only
Movement.
requirement for yogic practices.
Yes, I totally agree, sir.
I mean, since the patients present in a wide variety of ways, it's a syndrome, so it can present in so many forms. So the treatment would probably depend upon how this particular patient is presenting and what the underlying major underlying causes are. But still, I mean, what are the usual treatment options available to these patients,
Yes, you are
especially
very
from the
right.
gynecological point of view?
Yes, you're very right that since it is symptom complex and the treatment depends upon the core problem the patient has come from and also the age group. But the basis of all this treatment is you may give them fertility treatment, you can give them cycle regularization treatment or anti hirsutism, that is hair growth decreasing treatment. But the basis of all is lifestyle modification. Every treatment will help and will be most effective if all these treatments are in association with your modification of diet and your lifestyle modification. I'm not asking for that you decrease a particular to a particular weight. Say your weight should be according to your BMI. No, it is not important. What is important is that avoidance of further weight gain is very important. So you should have a regular exercise program, not necessarily daily. You may be busy on some days, you may be a little free on some days. So just make it for yourself that let it be 3 days in a week for myself. So individualize your treatment, but there should be an element of regular exercise. There should be a very important primary element of healthy food habits. That is fresh food habits, avoidance of junk food habits, and physical activity and stress buster, meditation, yoga, listening to music, dance. Adopt one active hobby or a lifestyle that is going to keep your stress under control, that is going to keep your weight under control, and will stimulate you and encourage you to further adopt further active and healthy life habits. So, the main treatment, the core treatment of PCOS is exercise or meditation and healthy food habits, and also seek the medical uh, help sooner than later.
Yes, both for physical activity and relieving some stress. Some of the hobbies like dancing and so on that you talked
Yeah,
about can be very useful. Uh, and even listening to music is such a soothing effect, even if the person can't sing. Uh, these are important because these are young people, so they're
mm,
not interested in serious philosophy. But
yeah,
at the same time, uh, if they enjoy something, it is better than doing something as dead serious business. Because if they do it something as a burden to be carried for the sake of staying healthy, then the stress that it creates neutralizes the effect of the good thing that they are doing.
that,
So it's better that they do think what is right and also enjoy it.
yeah, like you have seen that nowadays the youngsters, they are all very fond of, on to be on phone with their cell phone. Either they are keep talking to their friends or they are watching some videos. So we can just tell them that if you want to talk to your friends or watch some videos, just keep walking. So whenever a phone is in your hand, start walking around the park or in your home and then talk to them. Then you see that 1 hour they'll walk because they are talking very happy talking to their friends.
Yes, one can keep the hands free. The
Yeah,
phone can be in the pocket and you have an earphone in the ears and you are walking and talking.
yeah,
Of course, I mean, it's not the best thing to do because whatever we do, we should do it mindfully. They're not walking mindfully, but all the
yeah.
same, walking even not mindfully is better than not walking at all.
Not walking at all. Yes.
Would you like to give a final message uh, for prevention of this problem, especially to the uh, young girls at the stage of puberty?
Yes, sir. Actually, prevention, because the patients are not aware that the problem is coming to them. So sometimes we don't do any screening. So more than prevention, it is that whenever the patients feel that something abnormal is happening with me and they feel distressed. And the girls, they feel distressed. In the class, ma'am told us, or my friends are having menses every month, but I am having every 2 months or 2.5 months. Or they are worried or annoyed because distressed because of the excessive hair growth on their face or excessive weight gain that is bothering them. So my message is that don't suffer for a longer period of time. Come to us as soon as you feel that there is some problem. Sometimes the patients are afraid that if we go to a doctor, they will write some treatment. So, my request to all the mothers, to all the family members, and all the women who think that they may have some problem, because these hormone problems are not like diabetes, that the sugar above this level is diabetes, below this level is not diabetes. There are certain changes that can happen. So, if we feel that there is some deviation from the normal, then come and seek the help of the doctors. We will discuss with it. We will let you know what the normal, and also in colleges and schools, the normal physiology and the reproductive system should be taught to all children, whether we're girls or boys, so that they know what is the normal process of puberty and what is the deviation. In that way, they will come to us very early in the early stages and we will be able to help them. And the end point will be that whatever the problem is, or whether they don't have any problem, adopt a healthy lifestyle, physical activity as well as diet. Then most of these problems, they will be controlled automatically.
I think the key message is that they should not feel shy, they should not feel inhibited,
Yes.
and should not therefore suffer for very long before they actually come to the doctor. Anything else? The last word.
But sir, I really enjoy doing this program because adolescent gynecology I'm very passionate about. And these young girls, they are a very sensitive group of people. So we are always there to help them, and they should always become. And public forums addressing these common problems should be done regularly, so that these women who are afraid or sometimes are not very open to come to the hospitals, by listening to such motivational talks and by listening to these interviews, they will be motivated and to do the exercise also and to adopt healthy lifestyles also.
Thank you so much. And I may bother you again for more such sessions. Thank you
Thank
for giving us your precious time this evening. Thank you.